Everyone. Just waiting for our guest tonight. Hey everyone, we're just waiting for our guest and I'm just gonna add him here. Darren, you're sideways.
Am I?
Yes.
I was afraid you were going to say that. That changes things. Hold on. I don't even know if this
Perfect.
Got to make it stand up. Hold on.
Perfect.
That'll
Hi
work.
everyone, my name is Alex and I work for Catholic Family Service, and this here below me is Darren and he's going to be our guest tonight. We are using this platform of Instagram Live to connect with the Calgary community. We understand things are difficult for families right now, and we're hoping by bringing people on every week, you see yourself represented and can see some of the struggles that you and your family have experienced during the pandemic. Darren has a really unique story, unique to me, but I bet you there's lots of people out there who have gone through some pretty incredible challenges recently. So Darren is a board member for the Unlocking Potential Foundation, the UP Foundation, which is the fundraising arm of Catholic Family Service. So all the incredible work that Darren and his board member team do at the Unlocking Potential Foundation makes it possible for our crew at Catholic Family Service to be able to provide service to families in Calgary. And so Darren and I are going to chat for a little bit about how he's doing and what's new with him and what's different with him. And then he's going to tell us a bit about his story of why he's here today and what he wants to tell us. And then we'll open it up if you have any questions or comments, things that you wanted to share or thoughts that you have while Darren's speaking. And that's what it's going to look like for the next little bit. So welcome, Darren, to your very first Instagram Live.
Yeah. I was telling Alex I don't even have Instagram, so here we are.
Yeah. So Darren, how are you doing today?
I'm good. Yeah. Work is insane these days, and this is my COVID haircut or lack thereof over the last 3 months.
Yeah.
And yeah, but overall doing really good.
Awesome. And so how you talked about work, how have things changed for the way you work?
Well, I used to go into the office pretty much 5 days a week.
Yeah.
Team of people around me, face-to-face meetings, lunch meetings, all that good stuff. And like most people, very quickly that came to an end, I guess, kind of mid-March. Yeah. And so I haven't been in the office in, pretty much 2 months now, and working exclusively from home on an iPad, trying to figure out how to work differently. But it's been really interesting. In a way, I feel more efficient.
Yeah.
But yeah, kids at home. Fortunately, my wife's not working right now. The very first week, I would say, my wife was still at work. I'm trying to build forts with the kids, and my job had sort of never been busier than when COVID really became what it was. And so yeah, the first week was incredibly challenging. Kind of wondered how we were going to make it through this. And then you quickly adapt, and you kind of develop new routines and a new normal. And yeah, so it's very different. There's lots of things I miss, but there's lots that I'm really enjoying as well. So.
Yeah. You talked about your job keeps you really connected to people in your life and in your workspace. And how are you all connecting now? How do you sort of maintain that connection even though you're not together?
Yeah, good question. I feel like I'm on the phone or email sort of all day long. Didn't even know what Zoom was, but seem to have 2 or 3 Zoom meetings every day. Yeah. Our office, we're Fairfield Watson, we're about 18 people.
Okay.
And every Friday afternoon, we actually get together as a team, and we talk about work stuff, but it's a lot of just connecting. And
Yeah.
sometimes there's a beer in hand for some people. It's like bring your own booze sort of thing,
Yeah.
but it's a way to stay connected and see each
Yeah.
other's faces and not just phone and email. But yeah, so from a work perspective, I would say that's sort of what it looks like. Lots of virtual meetings.
Yeah, us too. I think that's what everyone's going through. In the past couple weeks, I've started to notice headaches from Zoom meetings. So I feel like that's like that cumulative effect of over so many weeks just staring at your computer screen in a way that we don't even really do at work, right? You're sort of up and around, and so that concentrated time just staring at your screen is new for all of us. You have little kids.
Yeah, they're 7 and 5. So my daughter turned 7 in the middle of all this. So we had the fire truck come and surprise her. A
Yeah.
friend's a paramedic, so an ambulance came by. What did we do? In advance, we got a lot of our friends to put together birthday cards for her, and they either sort of dropped them off or we picked them up without our daughter knowing. So when she woke up in the morning, came downstairs, like the patio door was sort of covered in homemade cards. So it was, even though she couldn't have a birthday party, I honestly think it's going to be one of the more memorable birthdays for all of us. So you just had to be creative and yeah.
Is that kind of the name of the game right now for parenting two kids during the pandemic, being creative?
Yeah, for sure. I mean, the first week, like I said, I think I made 3 forts and I wasn't sure how many more I could do, but you just adapt. And
Yeah.
like most people can attest to, it's things like puzzles and video games. But some of the silver linings have been, having dinner together every night, really.
Yeah.
Whereas when Jocelyn was working as well, that was harder to do. We'd both come home from work and it's like, what are we going to do for dinner?
Yeah.
So there's been a lot of good things. I feel like I'm working harder and more efficient at home, but at the same time, I'll take might be a short break, but I'll go outside and play basketball with the kids in the middle of the day because they're home.
Yeah.
I need to see the light of day at some point. Or this week, my wife and I started kind of going for runs at lunchtime. So
Nice.
yeah, it's just a totally different routine, if you want to call it routine, than what it used to be, for sure.
Yeah. The line between home and work is very blurry, right? Which can be difficult, but also, as you say, can be like this incredible opportunity to connect with our family, to break out of a routine that you'd been, we've all been going through for forever and ever. So
yeah.
Awesome. So what would you say for you is the most difficult part about social distancing
I'm tempted to say it hasn't been as bad as I would have thought it was going to be, especially that first week.
Yeah.
When it kind of happened, my parents were down south.
Yeah.
And they were struggling at first whether to come home or not. And then eventually when they did decide to drive home from Palm Springs, it was pretty stressful for them in their 70s to be getting in the car, making the trek home, scared to touch the gas pump. Restaurants are closing, all that. And then when they got home, it was good to know they were back on Canadian soil and at home and closer by, but still couldn't visit with them. Finally, one day we kind of drove by in the car, surprised them actually, and just showed up and kind of had our visit from the car window. So that was hard. There's things I certainly miss about going to work where, me and colleagues would maybe go to the gym at lunchtime or even just going out for lunch, the camaraderie of being in an office. Like I said, though, for everything I missed, there's been positives on the other side. So
yeah. And I think that's what everyone's, I don't know about you, but everyone in my life is kind of going through a bit of like those mixed feelings about like, and now things are changing again, and what does that mean for me?
Yeah.
And as you said, I've lost some things, but I've gained some things, and just such an unusual situation to miss something so much, adjust to it, and then not want to go back to the way it was. It's kind of takes us on a bit of a roller coaster as humans right now, I feel like. Yeah. So speaking of a roller coaster, you've been through a bit of one of those. Why don't you just go ahead and, if you don't mind, just what happened to you?
Sure. Yeah. I guess I'll go back to sort of early February. I was in Costa Rica for my best buddy from Kelowna, childhood buddy, his wedding.
Yeah.
My wife and I went, no kids, great vacation. Life was good. Like, had no reason to believe anything was wrong.
Yeah.
No concerns. And came back in mid-February, so a week or two later, I guess, started to just sort of have some symptoms or notice some things that got my attention. They weren't crazy, alarming symptoms, but nevertheless, I paid attention to them, and probably more than a lot of guys would have, because like I said, they weren't crazy obvious things, but I guess I was in tune enough that I pursued them, even though maybe a lot of guys wouldn't. We're stubborn. But so, yeah, started, did some blood and urine and an ultrasound, and ultimately was booked in to go have I guess a biopsy on a tumor on my bladder wall. And so COVID really, if I recall, kind of became a really big deal on a Friday. It was, I don't know, March, I forget, mid-March. Anyway, March 23rd, it was a Monday. I go in a Rocky View, again, scared to touch door handles and all that. And I think I'm going in for an appointment that will probably include a biopsy where they're going to test this and get back to me.
And you're by yourself, because
I'm by myself.
This is the first week of the pandemic.
Yeah. And in that 5-10 minute appointment with the urologist, basically when he's in there with the camera, he said, we're 95% sure this tumor is cancerous, so we're going to perform surgery today. So that was pretty overwhelming to hear. Lots to process very quickly. And then, of course, I said, can I call my wife? And yeah, you can call her, tell her you're having surgery, but she can't come because of COVID. So kind of go get settled. Surgery is going to be a few hours away, and I'm kind of calling and texting family and friends, and pretty emotional because the doctor sort of described to all the, they have to, all the little things that could go wrong, all the disclaimers.
Yeah.
And, I'm trying to articulate this to my wife over the phone, and basically what I heard, whether I heard it accurately or not, but you might wake up without a bladder and or a prostate if things don't go as planned. And so, yeah, it was a lot to digest very quickly, but a few hours later, I was having surgery. I wasn't going to be put under entirely, but I did wake up in another room, so I guess I did go out, and surgery went well. And I was home the next day recovering. But now I had about a week and a half, what ended up being about a week and a half to wait for the official results. But I think a bit of a blessing in disguise was that when they told me it was 95% cancerous in that appointment, I guess, I kind of had to come to terms with it. Like, I heard 100 basically. Wow. I had to come to terms with it immediately. And so that week and a half was really hard for my wife and I, but I kind of knew it was cancerous. It was just, how bad is it? And that week and a half, you do wonder what your future holds, and am I going to be here next year or in 6 months? How far along is it, right? Yeah. And then, I got that phone call, and it came back as low grade and non-invasive. And basically, in so many words, caught it early. And it was a weird thing because it was almost like relief while still learning that you have or had cancer all in the same sentence.
Right.
Like I remember my wife and I had like my first sort of rum and coke in a month or something, and we kind of celebrated that night that my prognosis was so favorable, but I still learned for certain that I had cancer, and
Yeah.
so really weird, but
Yeah.
positive in the end.
Yeah. Just I can't even imagine to we as people rely so much on the people we love in those moments, and to not be able to be comforted by the people you love and who love you. I just cannot imagine what you have to summon in those moments, right? Like,
Technology helped.
yeah,
Um, but yeah, I know my parents, my wife, my best buddy in Kelowna, they all use the word helpless. Like my friend from Kelowna just wanted to get on a plane and come to Calgary, but he couldn't.
yeah,
So yeah,
yeah.
it was an
And
interesting 24 hours and then sort of week and a half.
yeah. And so you talked about your all your family and friends wanting to come to you. And so what was that week and a half like? Just sort of like holding on, keeping in touch with people. Like how did you get through it?
Yeah.
How did you keep yourself together?
Somehow,
Or
well,
maybe you didn't.
no, I did. I love work, so I just kept working through it, and work kept me busy and distracted. And again, fortunately, I love it. But
Yeah.
yeah, lots of time on the phone with friends and texting, and just with the kids, like just I don't know, staying busy and optimistic. And again, the fact that like in Costa Rica I didn't have any symptoms, I like to think that I caught it early. I didn't have that reassurance yet, but um, yeah. And this is about as personal as it gets, but those that are closest to me know this, but my wife was married before, and he actually died in his early 30s of a type of bladder cancer. So that was probably the hardest part, was not so much how I was doing. It was more, am I going to be here in a year or five for my young kids?
Yeah.
And most importantly, I couldn't believe my wife was having to go down this path again. So
Yeah. I mean, all the thoughts of like, what are the chances? Um, and, and what that must have brought up for her. Um, I can only imagine.
she's strong, but yeah, that week and a half she was anxious for sure.
Yeah. Was there anything I think about, it strikes me, I've talked to you a few times that you're a pretty optimistic guy generally. Is that fair?
Yeah,
Maybe not. Well, you seem like you are.
yeah.
Um, was there anything in particular that you and your family did, or things you said to each other or to yourselves to get through it? I think about, um, you know, so many stories of people who can't see their loved ones when they're going through something, and I'm I there's probably people right now going through something similar, and I wonder if you when you look back, if you have any sort of insight, and was there, except trying to sort of stay positive, was there anything else that worked for you both to get through it?
um no, I don't think there was any secret strategies. It was
No.
just,
Yeah.
you just, yeah, it makes you very aware very quickly, yeah, how fragile life is. And it gives you, like, on my Facebook, I don't have Instagram, but I do have Facebook. And
Yeah.
in the hospital, I did a post,
Yeah.
and it was a lot of reflections that I had when I all of a sudden was going into surgery, and it was so unexpected. I was in sort of deep reflection, and I shared those thoughts
Yeah.
during that week. I don't know. I don't know if there's an easy solution to how to get through it. I know, in fact, like when I could feel my wife sort of being super, yeah, I didn't like when it was almost like she was unsure and she was comforting me, and I was like, I didn't want to make. It's like, I'm not dying. Like I can't explain it, but
No.
like we were we would maybe cuddle more or whatever, but at the same time, I didn't want it to feel like we were treating this like the end. Like,
Right. Right.
it's hard to explain.
Yeah. That's sort of like clinging to a sense of normal and things are okay. Um,
Yeah,
yeah. Yeah. That makes a lot of sense. And, uh, it sort of speaks to the fact that there was no plan and you didn't have to, you just got through it, sort of speaks to the resilience of the human spirit of like,
yeah,
you got to do it when you got to do it. And that's kind of what you two did, was just survived it. And, I think about, your parents having to come all the way back from Palm Springs in the height of as things were starting to shut down in the States, I imagine, and then this, uh, they've really been through the ringer too. So it's not, these kind of things affect, like there's a ripple effect. It affects everyone.
yeah, yeah. Like, yeah, just friends started to question their own health and
Yeah,
take it more seriously.
yeah,
Yeah,
yeah. You said something interesting that we didn't discuss, but it's like a really interesting message for men about their health. I don't know if you're wanting
yeah,
to share that message, but but sometimes men do not, or they ignore. Would it be fair to say they ignore or sort of push down
yeah,
those? Yeah,
yeah. I have no problem saying us guys are stubborn and whatever. So because I'm in the insurance business, I'm pretty fortunate that I'm, we have different services available to us.
yeah,
So as an example, we have virtual healthcare, something called Wello. So for me, when I sort of had my first symptom, it was really easy for me to get on the phone with a nurse practitioner like
yeah,
30 minutes later. I
yeah,
didn't have to wait to get in to see a GP.
yeah,
So I think my access to that type of service made it easier. If I
yeah,
didn't have that and I needed to go physically see a doctor, maybe I would have been the more typical guy and just said, "Oh, I'll give it some more time. It'll go away." Or because
yeah.
again, my symptoms weren't crazy obvious, but
Right.
um, yeah. So yeah, trust your instincts.
Yeah.
You, nobody knows your body really better than you do yourself. So if you think something's wrong, maybe it's not, but at least, yeah, look into it.
Totally. Yeah.
Because in my case, I think because I was proactive, I caught it really early, and I could have easily pushed this off, and then who knows?
Yeah. I mean, never a more inconvenient time than now to have to deal with something like that, right?
Yeah,
Um, yeah. Incredible, incredible story. And what's another part to this story is that after all this happened, you made a decision about something that maybe you can share.
sure.
Um, that is how another connection we have today. What can you tell us about that?
Yeah, so I've been working with Catholic Family Service for about 3 years on the upboard.
Yeah,
So it's very near and dear to my heart. The Patricia Jones there, the leadership team, any staff I've met, the people we serve, it's just it's super meaningful to me. The
yeah,
people and the work that gets done and the lives that are impacted. So um, again, being in insurance, I have critical illness insurance,
yeah,
and not to say I never thought I'd use it or make a claim, but I didn't think it'd be at age 39.
yeah,
But I did. I made a claim, and because I had some proceeds coming from that, my wife and I just felt compelled to give back to CFS because the work they do means so much to us. And just because of COVID, there's the challenges in the community are that much greater. The funding that we have access to is compromised, all kinds of things. So
totally.
yeah, we chose to make a donation to CFS. But basically, I was laying in bed one night and I said to Jocelyn, I think we should donate $5,000 to CFS, but I don't want it to stop there. There's got to be a way where we can turn 5,000 into 25,000 or maybe 100,000.
Yeah.
And so I started talking with my business partner, Tony Fairfield at Fairfield Watson, and I shared the idea with him. And he said, well, how about Fairfield Watson matches your 5 corporately? So now we're up to 10, and we can really kind of try to create some momentum from there.
Yeah.
So that's where the idea was born. We were going to go out to kind of individuals, corporations that might, and this is a hard thing to do right now, but might have the capacity to donate $5,000.
Yeah. Yeah.
And I started talking to one of my best buddies, John Koppel, who's on the board with me. And I told him what I was thinking about. And he goes, oh, well, I can't donate $5,000, but I could do 500. And that's kind of when the light bulb went off. And I realized we could reach so many more people, and so many more people could participate in this if it was, and I came up with 5 for Humanity at that moment. And $5,000, $500, $50, or $5. It really doesn't matter. Everything counts. Everything adds up. And yeah, I just thought about sort of the number 5 and how yeah, I don't know. Patricia uses the word lots, but humanity, like everything we do at CFS, whether it's the Never Too Late program, Louise Dean, the list goes on. It's all about humanity, and everybody, yes. You know, whether it's the child of a teenager going to Louise Dean or whatever, like every human life deserves sort of the best chance. And yeah, so I don't know, 5 for humanity. So here we are.
It's incredible. And do you happen to know how much you've raised to date to this moment?
I'm embarrassed to say how often I check it. So yeah, I know. Yeah, we're just shy of $32,000 right now. So we did a soft launch maybe 2 weeks ago. We officially launched last Tuesday on Giving Tuesday. Yeah. But yeah, we basically turned 5 into 10 and 10 into 32. And yeah, I'm just hoping, I know I'm super sensitive to the fact that it's a tough time for people to give.
Yes.
But it's all relative. And, you know, the people we serve are in many cases very vulnerable right now. Yeah. And so maybe some corporations are still doing well and have the ability to donate $5,000 right now. Or maybe as an individual or a family, you can give $5.
Totally. Yeah.
You know, it's the whole, what's the quote? It's like the whole is, the whole is greater than the sum of its parts.
Yeah.
So lots of small acts of kindness can really add up to a really big impact. So.
Absolutely. And I think that's been the cool part of the campaign too, is that, that we have seen people give just $5 because that's what they can give right now. And it is a tough time for a nonprofit organization who serves vulnerable folks. And but, you know, as you said, people love to volunteer. People love to give back. It's meaningful to them. It gives their life meaning. It makes them, you know, feel good. It makes them feel like they're contributing. And right now it's kind of hard to do that. And so, you know, giving the little bit you can, or the big bit you can, depending on who you are, is wonderful. And clearly people are doing that, because it's been 1 week and look where we are. And what an incredible thing you've started from something pretty challenging to go through, as you said, at 39, is something that a lot of people, you know, will never experience. And so I thank you so much for sharing that. I do wonder if anyone has any comments. You've had some cheerleaders in the audience. I always tell guests, we don't usually get questions, but you never know. In the meantime, it might be a good time. You talked about some of our programs, and there's so many, but one that we like to mention on here when we get a chance is our Rapid Access Counseling Program. And the really great part about all our programs, but but it is that we have been able to switch to completely online services, and we've gotten really, really pro at running our counseling program through video service, and it is pay what you can. There is an incredibly skilled group of counselors who are there to talk to people about all kinds of things. Are going through things like what you went through, feeling grief and loss and sadness, and just wanting someone to talk to or to work through something that they're going through. And people can book it themselves on our website. So programs like that are and so many others benefit from the incredible thing that you've started with Five for Humanity for Catholic Family Service. So we are so, so grateful for you, and to be vulnerable enough to tell your story is not an easy thing. So I so appreciate you coming on today, Darren.
Yeah, thanks.
I don't see any questions. So if you want to donate to Five for Humanity, you go to the Catholic Family Service website. It's very easy to navigate. And yeah, thank you, Darren.
Yeah, thanks. Yeah.
And have a good evening.
Hey, thanks everyone.
Bye.
Bye.